Good morning. Good to be with you. Look, I mean, the most important thing to do would be to, uh, announce the plan, not just pieces of it, because I think there's a great deal of anxiety abroad. When I say abroad, I mean throughout the country, among most people, about the viability of the plans, of the plans we know, and whether we will get sufficient vaccine in good enough time and be able to roll it out to the population to get to the levels that we need to.
I mean, again, we've been told that the rollout will happen in three phases, healthcare workers being amongst the people getting a priority. We've been given a breakdown of where some of these vaccines will be coming from. So I can imagine a lot of people in government suggesting, but hold on, a plan has been communicated. And if there's still questions, it becomes a matter of trying to ascertain which aspects of this plan still need clarity.
Look, there's no doubt that there's probably a lot of work going on behind the scenes, which we're unaware of. If we go by what is known for a fact, we understand that the government wants to be the only party that procures the vaccine. It also wants to be able to centrally roll out the program on a very linear fashion. So, as you correctly said, they first want to vaccinate the health workforce, then go to the next phase, vaccinate the vulnerable groups, and then go to the more broader phase to get the required numbers of some 40 million vaccinated. That would have been possible had we started much sooner. The fact is, we haven't. We don't yet have security of supply. We understand negotiations have now begun, and the outcomes of those dependent on global demand. We're right at the back of the queue now because we started so late, and it was only the president's stepping up early in January to deal with his counterpart in India that got us these 1.5 million doses. Now, we can't be doing this on an ad hoc basis and then hope to conduct a vaccination program that would see up to 300,000 people vaccinated daily, every single day, 7 days a week, with the requisite staff in place and the facilities, security of supply, security of delivery, and most importantly, a willing and cooperative population. So there's a whole lot of gap, or many gaps, I beg your pardon, in the plan as we see it. Clearly, they must be aware of these gaps and are trying to fix it. But it's again a case of perhaps starting too late, not having the requisite ability to pull the country together behind a single plan, and the centralized control of the planning and the rollout is actually unacceptable right now because for the simple reason that if you were to go with this linear fashion, you certainly won't get to herd immunity by the time you expect to. Right now, because we're short of time, we should rally all platforms in the country, private sector, public sector, and all others who are able to acquire vaccine, bring it in, vaccinate as many people as possible in all different settings that we can for the government to then maintain a coordinating role over that, rather than being the only party that will bring it in. This is already proving to be a disaster.
I wonder, Doc, if we're able to take a step back briefly. Can you tell us a bit more about the Progressive Health Forum and whose interests you represent?
Okay, so the Progressive Health Forum is a advocacy network of health experts, health veterans, researchers, and scientists, and so on, and activists. And we came together in 2017, concerned with the state of the public health system, in which we are all very interested. And that led to the Presidential Health Summit. You might remember that. And we continue to be concerned with the state of the health system. The pandemic obviously brings our focus now strictly onto COVID-19. And this is why we have been doing what we have been doing and actually wrote the letter at the beginning of the year decrying the lack of a plan, which seems to have added to the pressure put by media and others to get the government moving on one.
Right. I wonder if we can also take time then to speak about some of the other emerging issues from the media in part, and that's around the pricing of the vaccines. Long story short, it appears we're paying a whole lot more than other countries in Europe and I think some other nations even on our continent. But government says this is because of a lack of bargaining power, and I'm paraphrasing here. Don't they have a point?
Bargaining power, certainly, but the official line that came out that the reason we're paying more than the richer countries is because they invested in the R&D for the vaccine. This is a little surprising. We know for a fact that the EU, for example, did not participate in the development of the AstraZeneca vaccine, which is the one we're interested in. So that's not true. And that secondly, we conducted the trials for that vaccine right here in our country. So if anyone should benefit from the R&D, it should be us. So that doesn't ring true at all. And I think it's a bit part of the spin of the department trying to cover itself now that it's been so late in the game. And I think that's true also that you can't bargain at this stage when you're right at the back of the queue actually holding out a begging bowl. So you're going to be a price taker, which seems to have been what has happened here, that we're going to have to take it at the price that it's available at. The inability to negotiate it down is something that they'll need to ask themselves about, but it's very disappointing that we are now going to be paying a premium when we didn't have to.
As activists in the space, don't you think some accountability should also be meted on the manufacturers themselves? I mean, the idea of profiting from a pandemic with devastating effects appears out of kilter at the very least.
Yeah, look, I mean, it can be seen as such, but understand that that's how the pharmaceutical industry works with all medicines. There's nothing new here. A number of them have said that they will give it at cost or near cost during the emergency phase of the pandemic, and that's yet to be seen. But that's just the way the pharmaceutical industry in a globalized world is organized. And pricing is controlled by international trade agreements and so on. So, there's not much you can do about that right now. The pandemic does give an opportunity, however, to alter that regime of pricing in pharma into the future. Right now, though, we have to protect the country. And really, this is the nub. The longer it takes for us to vaccinate our people, the more surges there are going to be, the more illness and the more deaths. So that's the equation. And that's the focus we need. The president, in our view, should harness the country's resources right now. He must act as the president of the republic, bring in all of the best and the brightest in the country, all of the possible platforms that can acquire vaccine and deliver it, and under his authority, direct a national program. All that has happened by the government that wants to do something is set up another committee, which we're seeing as a clone of the lockdown committee, the command council, and it's we have no information coming out of that about anything they're doing so far.
I guess then, what perhaps might be a valuable way of moving forward is trying to ascertain what needs to happen now. If the health minister was at your service, so to speak, what would you say his immediate objectives should be to try and stay for worst case scenario?
Okay, I think the health minister is probably completely aware of the issues we are talking about. He is very hardworking and he understands what needs to happen. He may not have been very well served by his officials, but it is what it is. And clearly, acquisition of vaccine comes first because your rollout doesn't work if you don't have the vaccine. So I hope there's a plan in place to do maximum negotiations with all of the manufacturers we can get to obtain doses of vaccine. And then, of course, I think the logistical management of a rollout is, and it is complex, but it is the easier thing to do, in my view, because the systems are there. Private sector is very willing to help, and I'm sure the government is talking to it, but no one is talking to the people. And I assure you, that becomes the most important part, not the rollout, the take-up. Vaccine hesitancy is increasing because of the lack of information. So a step change in the communication around this is necessary. The civil society organizations that are embedded in communities need to be brought on board to the top table to both provide oversight and communication capability in the idiom to which communities are accustomed, to get vaccine hesitancy down, get them cooperative, so that when the vaccines come, and they will come, we have no doubt, the people are ready to be vaccinated.
Dr. Aslam Dasoo, truly appreciate your making time for us this morning.